I have Dr. Tommy Ibrahim, Sanford Health Executive Vice President and President and CEO of Sanford Health Plan, joining me from the Health Conference in Las Vegas, Nevada. Tommy, thanks so much for your time.
Oh, it's so great to be here, Courtney. Thanks for doing this.
Yeah, you joined other health leaders, I understand, for a panel discussion exploring how both health plans and health systems are using AI tools to improve patient engagement and ensure better outcomes. What were your key takeaways from that panel?
Yeah, we had a really great slate of panelists speaking about both the provider as well as sort of the payer aspect of implementing artificial intelligence. It was a really robust discussion. I think some of the major takeaways were really in terms of, all of us sort of across the health system ecosystem are in the same place. We're really trying to figure this out as we go. I think there's been some really great successes so far along the way. But by and large, we're all evolving in this new and emerging technology. And I think that gives all of us great comfort. It was really interesting to sort of see some of the friction that people are anticipating actually as payers and providers both start to implement this technology. A lot of robust discussion about whether or not there's sort of going to be an emerging battle of the bots, if you will. And I think by and large, the entire panel felt that as we continue to learn, as we continue to really improve transparency and increase communication between payers and providers, that will largely, abate and actually hopefully improve things for both parties, but most importantly for our patients and our members. So I think there's really a lot of excitement about where the technology can go in the future.
What are you learning there as it relates to innovation, and how does that shape your vision for Sanford Health Plan?
All of this innovation is absolutely here to stay. I mean, I think we sort of question whether or not things are going to have traction. How long it'll take to actually become truly embedded in the ecosystem. The amount of capital and sort of the innovation going into all of these new emerging technologies is absolutely enormous. And I think the one takeaway there is that this really is here to stay. We really need to continue to think about how we adopt and transform and evolve. And to really our mantra back home at Sanford, what we do will never change, right? But how we do it needs to continue to evolve. And I think, being amongst this incredible slate of people here, it's just really exciting about the possibilities long term.
What would you say is the biggest disruptor right now, Tommy, in healthcare, and where do you see the biggest opportunity?
Yeah, I mean, it's all about AI right now. Just talking to everybody, that's sort of the buzzword. Everyone's trying to figure this out. There's so much investment and so many disruptors really trying to come into the space to understand more about how data and machine learning models can help really move the industry in a very positive direction. So I think the buzz across the panels, some of the other speaking opportunities that we've been able to participate in here is all about artificial intelligence and how that's going to be transformative for this next era.
Mm-hmm. Yeah, fascinating. Thank you for that insight. And looking ahead now, bringing some of this information back home, what excites you about the future?
Yeah, I'm really super, excited about the fact that Sanford is actually on the leading edge of this. The work that we're doing on the national landscape, the work that we're doing in DC, through the efforts of Bill Gasson and others, to really help shape and reform, the sort of the rollout, the deployment of artificial intelligence across the ecosystem is super exciting. I think, I've learned about, both on the provider as well as the payer side, all of the great processes that we've already deployed across our organization that bring AI capabilities to it that really help advance us. I think we're actually in a really good place relative to the rest of the industry right now. And I think if we continue to do exactly what we've been doing, I think we're going to be in a really good place.
Very exciting. Dr. Tommy Ibrahim joining us from the Health Conference in Las Vegas. Thank you so much for your time.
Thanks, Courtney. Appreciate it. Take care.